absorbed by the tissue. That's the newer way. Sometimes it works, sometimes it doesn't. And so the injection, we usually check with you every 24 hours. We need to do a blood test. Every 24 hours we do a blood test if it's an ectopic pregnancy, because every 24 hours the numbers, if we do the injection, the numbers should go down, that the pregnancy is going away. If the numbers are going up, and the numbers triple by day, they could be 1,000 today and tomorrow's 4,000. And the next day it will be 9,000, because the pregnancy hormones are increasing and building up.
When you say 1,000, it's 1,000 counts of hormones.
Yes, with the hormones, with a particular hormone we're looking in there in the pregnancy.
Okay.
And so if that's the case, then we have to bring you into the OR and we need to remove it, because then the injection didn't work. We also could do the same if a woman got pregnant with, let's say, triplets. We call it a reduction. And let's say she doesn't want to have 3, cannot handle 3. We can inject one of the triplets and they dry up.
Oh my God.
And they look like this. When they come out, they look like this, like paper, this thin. They dry the triplet up, and they end up like this, flat, like the face, everything is flat like this. And it's a medicine that they use to flatten the twin or the triplet, or more.
What is it technique again?
It's a reduction. A pregnancy reduction. Yes. I'm sorry.
I'm sorry to get eventually to this. I just
No.
because I saw something that I never saw. Because I know a friend that has endometriosis. So I didn't knew that the woman have a part called endometrium.
Right.
So when the woman has endometriosis, like what happens? Like what
Oh, sure.
causes that?
Good. Endometriosis is an actual disease that I'm going to show you a picture in the next pictures. They're going to show you a picture of that. No, that's fine. That's good. It's a good question. And endometriosis is a disease that what happens is that when we get a period, we bleed through here. So as we're shedding this, right? This is hormones and this is cells. What happens is that these cells all the time are supposed to come out, but for some reason, for some women, the cells go and start traveling up the other way. They get out of the area. When they get out of the area, we call them implants. They plant themselves, let's say, in the tube. They came out and they plant themselves here. Now these cells are supposed to bring blood into the area because they were here doing that job, getting blood so you can get a period. So they start doing the same thing in here, trying to find blood from the system. So they become like blisters of blood. But see, the tubes are not supposed to have blood on top of it. There could be blood within it, feeding it, the muscle and everything else, but not on top of it. Just like the brain. The brain doesn't like any blood on top of it. Whenever you have a clot or something in top of the brain, it's like acid. It burns it, in a way, to put it in a way. Yeah. And so these implants hurt because they're not supposed to, they don't belong there. And they can implant themselves outside the uterus, in the intestines. And these women suffer from horrible pain because they're always in pain. Because these implants make you when they are full of blood, they hurt. They damage the tissues they're sitting on. So in order to stop that, what we have to do is to stop the periods. Give them birth control pills or shots so they don't get a period at all. Which of course, what happens? You can't get pregnant. So if they want to get pregnant, they have to go to an infertility specialist so they can plan the pregnancy. Because it's going to be touch and go there. It's very difficult for them to get pregnant.
The pains my friend gets are so bad that sometimes you have to do it before people.
Yes.
Just too bad.
Yes, it's really, really bad. The pains are not to play. It's really bad pains. So, and it's something that they have to stop her periods in order. And when she wants to get pregnant, then she can stop the pills under a doctor's order, and they can do certain things with the hormones to get her pregnant quickly before she suffers anymore. But she needs to get a birth control and not get periods, and that's how she will get better.
Yeah.
Yeah, that's a problem. That's a problem. She's gonna suffer a lot.
Because what the thing is that the doctor told her that she could get on the pill, but her case was so severe that there might be a chance that the pills just mess with the period process and she could never have a period again. Because the pills they have to give her
Yeah.
was like a antidepressant or something. She explained something to you.
Yeah, the pills have to be continuous. She doesn't stop ever to break her period because we don't want her to get periods. But when you take pills like that all the time, then you don't produce this because you don't shed the endometrium. So-
That's what she's saying, like something, but the doctor told her that if she could take the pills, but then after a time, it could stop her from ovulating ever again, and that's what she doesn't know.
That's not
I
quite
don't know.
accurate.
That's
She
what-
should go and see somebody else for a second opinion. I mean, she won't ovulate while she's doing this, but once you stop taking birth control pills, normally after 2-3 periods, you should ovulate. Unless she has some sort of disorder, that she has hair in her face and chest, or that she has something called hirsutism also, which is a problem with that, but she should get a second opinion just to be on the safe side. I would suggest. Good questions, guys. So now we know what the topic looks like, how it happens. Now, when we go for a pap smear, we women think that we're so set. We get a pap smear, we're all set, we have no cancer. So when we actually go for a pap smear, what we're looking for, we can only get this far, the cervix. This is your cervix. We only get this far. So what we do is we put a little brush, we go here, rub it back and forth, a little here, that's it. And we're looking for cervical cancer cells. So usually, if there's some sort of cancer up here, the cells will eventually come down here. But we really cannot tell if you have cancer up here in the ovaries or anything up here. That's why a pelvic exam is essential. Because we can't tell. So the pap smear may be perfectly fine, but there may be something going on here. As we get older, it's even more essential, even more important, because we can develop ovarian cancer. So a lot of women, because they're older, they're not having sex as often or no sex at all. So they're like, I'm not using the equipment. Why am I going to have a pap smear? And that's wrong. Because you see, that has nothing to do with you using the equipment or not. So if they don't get a pelvic to feel the ovaries, this is why a lot of women get diagnosed with ovarian cancer very late. Because they stop getting pap smears, so they stop getting pelvic exams. So they will tell you, you don't need to come back for a pap smear for the next 3 years, because now they're spacing us like that. Cancer cells don't grow from 1 month to the other or 1 year to the other. It takes years to grow. So we used to think it was sooner than that, but now we know better. But the reason why you want a pelvic exam is always to check the ovaries to make sure the ovaries feel normal. Just like guys that need prostate exams. It's the same thing. You guys need prostate exams as you get older, or if you have a history of prostate cancer in your family, because you cannot tell if your prostate is getting bigger inside or not without an exam. And so and by the time, and these are cancers that can be treated very easily, really easy. Like prostate cancer is so easy to take care of. It's one of the cancers that we can take care of the quickest. But a lot of men don't want it because they have to have a rectal exam, which takes 5 minutes, and they prefer to die a horrible death than to get a rectal exam. My father was like, I think they knocked my father out. I think they gave him a sedative to go in there, because he was like, no, I'm not gay. And I'm like, you may after you finish it. No, but it took us forever to get him to do a pelvic exam. Because he was 85 years old, he didn't like, nope. And when they actually did it, he did have prostate cancer. and they were able to catch him in time to have treatment, and that was it. If he had waited another year, and it was totally by luck that we were able to get him sedated to get enough.
I understand there is also a blood exam that will help to diagnose prostate cancer.
The blood test helps, but not as good as the physical exam. The blood test sometimes can have a false positive, so that may be, or false negatives. There's a lot of controversy right now about the blood test. Blood tests are really important though, because we can tell if it goes up or goes down. So at least it gives us an idea if something's going up, and if something's going up, then you can get like an ultrasound, and you can get something more. And if it's nothing, it was nothing. But it's better to be safe than sorry. So the pap smear, again, is these cells here. Now let's say that the pap smear came back positive. Okay, now the pap smear is positive. There is some dysplasia, which means the cells are starting to turn. They're not normal anymore, but they're not cancer yet. And so let's say that so what we do is we do a colposcopy. So we do a colposcopy, and the colposcopy exam, what it does is it actually, we look, it's a pelvic exam, but at the end of the instrument, the speculum, it has a special microscope. So we can see one tiny cell that you cannot see with the eye, this big. So once we see it, what we do is we actually, once we see the cervix, we bathe the cervix with vinegar, white vinegar. And the vinegar automatically makes the tissue white, where there is an erosion or dysplasia. So it turns it white, and as soon as we see, it's like peroxide. You know what peroxide, when you put it in a wound, it bubbles up and turns white? But if it's not open, it doesn't do anything. The same thing. Vinegar does the same thing to the cervix. And the cervix is like the color, like a baby pink. A very, very soft pink. No matter what color you are, you're the same color inside. So it's a very soft pink. And so if we see that, let's say that we saw this, it turned white there, we'll take a biopsy of that. And when we take the biopsy, we send it out to see if it's worse than what we think, or is it deeper? And if let's say if it comes back, yes, it's deeper. Now we are thinking this woman wants to have babies in the future. She doesn't want to lose her uterus. So what we're going to do is we're going to try to get this uterus healthy. So we're going to do a cone biopsy, C-O-N-E, a cone biopsy. So the cone biopsy is, what we do is we get the uterus, see how it's like this, right? We peel it, I think we mentioned it last week. We peeled it, and we leave just the stump. You cannot get pregnant for at least a year. Okay? Because otherwise you will miscarry, because there's nothing enough there to hold the pregnancy in there. This and all this we do. We go like that. We wait a year, and we wait till that skin to grow back, the tissue to grow back. Then we do the colposcopy again, and see if we see any cells. And we take biopsies again. If the biopsy is negative, you're cured.
So you've taken it out with that skin?
Yes, you took it out with those 2 layers of the skin. It's like 2 layers. And then so if it's perfectly fine, we don't have to worry about it anymore. The cancer cells or the pre-cancer cells are gone. If it came back again, now we have to talk about a hysterectomy. We need to remove the uterus. So when we remove the uterus, we can remove everything and leave the ovaries. If you're young, we can leave the ovaries. Right. They're attached to a ligament, but they're not like, but they're very close. If, depending on kind of cancers that you have, if there is a particular kind of cancer that is known to be very savage, very aggressive, then we take the ovaries out too. Because there's some kinds of cancers, like breast cancer, that is fed by the hormones of your ovaries. So we may want to get rid of them or stop them from working so they don't feed the cancer. So depending on what it is, we